Ever woken up with a sharp pain in your heel, making those first few steps in the morning feel like stepping on pins and needles? If you have, you might be dealing with plantar fasciitis. This condition is caused by inflammation of the plantar fascia, a thick band of tissue that runs across the bottom of your foot and connects your heel bone to your toes. It can cause a stabbing pain that usually occurs with your first steps in the morning. As your foot limbers up, the pain of plantar fasciitis normally decreases, but it might return after long periods of standing or when you stand up after sitting. A study published in the PubMed journal reveals that plantar fasciitis affects nearly 2 million people each year in the United States alone. If you've experienced this, you're not alone. Plantar fasciitis is a common foot complaint, but thankfully, there are ways to manage it. But why does this pain occur? What are the causes and risk factors? Let's dive into the root of the issue. Plantar fasciitis is typically triggered by factors that place a lot of stress on the heel and the attached tissue. Age is a considerable factor here. People between the ages of 40 and 60 are more likely to experience this condition. Certain types of exercise that place a lot of stress on your heel and attached tissue, like long-distance running, ballistic jumping activities, ballet dancing, and aerobic dance, can contribute to an early onset of plantar fasciitis. Foot mechanics are another culprit. Flat feet, a high arch, or even an abnormal walking pattern can affect the way weight is distributed when you're standing and can put added stress on the plantar fascia. Obesity is another risk factor, as extra weight puts more pressure on your plantar fascia. Occupations that require long periods of standing or walking on hard surfaces can also damage the plantar fascia. A study published on PubMed supports these findings, outlining the connection between these risk factors and plantar fasciitis. Understanding the causes and risk factors can help in managing and even preventing plantar fasciitis. Now that we understand what causes it, what can you do at home to treat plantar fasciitis? Plantar fasciitis can often be managed with simple, at-home treatments. Let's explore a few of these. First and foremost, rest is crucial. By limiting or even stopping activities that make your foot hurt, you give your body the chance to heal. Next, ice is your friend. Applying an ice pack to the inflamed area a few times a day can help reduce inflammation and soothe the pain. Be sure to wrap the ice in a thin towel to avoid direct skin contact. Over-the-counter pain relievers, such as ibuprofen or naproxen, can also help manage pain and reduce inflammation. However, always remember to take these medications as directed and consult with a healthcare professional if your symptoms persist. Perhaps one of the most effective home treatments is regular foot and calf exercises. These can help stretch the plantar fascia and Achilles tendon and strengthen lower leg muscles, which stabilizes your ankle and heel. A simple exercise is to place a small towel on the floor, then pick it up using only your toes. A study published in PubMed confirmed the effectiveness of these home treatments, showing significant improvement in patients who followed this regimen. These home treatments can provide relief and help manage the symptoms of plantar fasciitis. Remember, patience is key. It might take a few weeks or even months for treatments to take full effect. But in the meantime, these methods can offer some much-needed relief. So, plantar fasciitis might be a common issue, but it doesn't have to take over your life. We've looked at its causes and risk factors and explored the effectiveness of home treatments. Remember, knowledge is power. Recognizing triggers and applying these home remedies could make all the difference. As always, consult with a healthcare professional for personalized advice. Thank you so much for watching. If you found this video helpful, please like, share, and don't forget to subscribe to our channel Facts Academy 0122 for more informative videos like this one.